What is the best blood pressure for elderly people? What happens to your body when blood pressure rises as you age? Are the numbers we consider ideal for younger adults really safe for seniors? And what is the balance between the benefits and risks of controlling blood pressure at lower levels? These questions are essential to understanding the impact of hypertension on people over 65. As we age, many face the reality of a high blood pressure diagnosis. What is not always clear is the extent to which treatments, however well-intentioned they may be, can pose risks, especially when intensified to reach very low pressure levels. After all, is a blood pressure of 180 ideal for everyone? Or could it be that, in the elderly, more conservative control is safer and more efficient? In this text, we will explore the numbers, studies, and choices that can make a difference to health in old age. What happens to your body when blood pressure rises with age? Over the years, the human body undergoes changes that directly affect blood pressure. Natural aging causes structural changes in blood vessels, which tend to become less elastic. This stiffness makes blood circulation difficult, increasing pressure within the arteries. Another important factor is the hormonal changes that accompany aging. Hormones such as renin, which regulate blood pressure, decrease their production, affecting the body's ability to maintain an ideal balance. Furthermore, the kidneys, which are crucial in controlling blood pressure, also lose efficiency over time. These changes make hypertension a more prevalent condition in the elderly. Even without a family history, it is common for blood pressure to gradually increase as you reach old age. However, the problem is not just the increase in pressure, but the complications it can bring. Cardiovascular diseases, such as heart attack and stroke, are more common in people with high blood pressure. Furthermore, uncontrolled hypertension can lead to damage to vital organs such as the kidneys and eyes. Therefore, it is crucial to identify these changes and treat hypertension appropriately, respecting the particularities of each organism. However, intensive treatment to reduce pressure also carries risks, especially in frail elderly people. Falls, fainting, and kidney problems are some of the possible complications. Therefore, understanding how the body reacts over time is the first step towards more efficient and safe care. Are the numbers that we consider ideal safe for the elderly? Traditional guidelines have always indicated 120/80 as the ideal blood pressure for adults. This number is widely known and, for many, represents the synonym of cardiovascular health. But can this same goal be applied to all elderly people? Aging brings natural changes to the body that directly affect blood pressure. Blood vessels lose elasticity, kidneys may become less efficient, and the hormonal system begins to function differently. Therefore, it is normal to see a gradual increase in blood pressure even in healthy people. Recent studies have shown that reducing blood pressure in the elderly to extremely low levels may not be safe. Although controlling high blood pressure is essential to prevent diseases such as heart attack, stroke, and heart failure, you need to be careful with extremes. Very low pressures can cause dizziness, fainting, and falls, which, for elderly people, pose a significant risk of fractures and hospitalizations. More recent guidelines, such as those proposed by the American Heart Association in 2017, began to adopt more aggressive goals. In them, hypertension is diagnosed at readings of 130/80 or more. This means that many elderly people who were previously considered within normal limits are now diagnosed with hypertension. For some doctors, these new criteria bring benefits, as they encourage more rigorous control of blood pressure. However, for frail elderly people, or those with multiple comorbidities, reaching a level of 120/80 may require strong medications that have serious side effects. Therefore, ideal numbers for seniors are not universal. Each patient must be assessed individually, taking into account their medical history, lifestyle, and physical capacity. The balance between benefits and risks is essential to ensure a healthy quality of life. If blood pressure is above 140 or 150, appropriate treatment may be necessary, but the search for excessive control must be done with caution and always under medical guidance. Changes in the rules, what you need to know about your blood pressure. Guidelines for the diagnosis and treatment of hypertension have undergone major changes in recent years. In 2017, the American College of Cardiology, ACC, and the American Heart Association, AHA, updated the criteria, lowering the threshold for diagnosing high blood pressure. Previously, a blood pressure of 140/90 was considered hypertension for younger adults, while 150/80 was the standard for seniors over 65. With the new guidelines, these numbers have changed. Now, a blood pressure of 180 or more is considered hypertension. Normal blood pressure is defined as less than 120/80, and values between 120 and 129 for the upper number are considered high. These changes were made based on studies that demonstrated the benefits of reducing blood pressure more aggressively, reducing the risk of cardiovascular diseases such as heart attack and stroke. However, this new approach has brought challenges, especially for older people. Many experts question whether these goals are safe or even realistic for older people. In an elderly person, achieving a blood pressure below 120 may require high doses of medication, which often result in adverse effects. These effects include dizziness, fainting, falls, and even kidney damage. Furthermore, there is an important point to consider: quality of life. The search for very low blood pressure can compromise daily well-being, especially in frail elderly people or those with multiple chronic diseases. Therefore, guideline changes require more careful consideration in elderly patients. The doctor must evaluate not only the numbers, but also the patient's general health condition, medical history, and risk of side effects. Instead of following rigid goals, treatment should be personalized. For many seniors, a systolic pressure between 140 and 150 may be safer and more appropriate than pushing extremely low numbers. The most important thing is to find a balance between the benefits of controlling blood pressure and the risks of aggressive treatments. The numbers that can save or change your life. Knowing how to interpret blood pressure numbers is essential for making informed decisions about your health. Blood pressure is measured by two values: systolic pressure, the top number, and diastolic pressure, the bottom number. But what do these numbers really mean, and how do they affect you, especially as you age? Systolic pressure represents the force with which the heart pumps blood into the arteries. With aging, it is common to see an increase in this measurement due to the stiffening of blood vessels. Diastolic pressure indicates the resistance of the arteries when the heart is at rest between beats. According to modern guidelines, values are classified as follows. A normal blood pressure is considered to be below 120/80, between 120 and 129 in systolic, with less than 80 in diastolic. It is classified as elevated. Stage 1 hypertension occurs when systolic pressure is between 130 and 139, or diastolic pressure between 80 and 89. From 140 to 90 or more, it is considered stage 2 hypertension. For the elderly, these values may raise doubts. Many wonder, if my blood pressure is 140, do I really need to take medication? The answer is not simple, as it depends on several factors, such as your general health, medical history, and the presence of other conditions, such as diabetes or kidney disease. Studies show that in the elderly, forcing blood pressure to very low levels, such as 180, can pose significant risks. Dizziness, fainting, and falls become real concerns, especially in more fragile people. A fall can lead to serious fractures and compromise quality of life. On the other hand, leaving high blood pressure unchecked is also dangerous. Pressures persistently above 150 can increase the risk of stroke, heart attack, and heart failure. This is why, for many seniors, a systolic pressure between 140 and 150 may be a safer and more balanced goal. The secret is to understand that numbers are just one part of the equation. The approach must be personalized, considering each person's individuality. Working together with your doctor to find the most appropriate goal is essential to avoid risks and promote a healthier life. Finally, remember, numbers have the power to save lives, but it is the correct interpretation of these values, combined with common sense and medical monitoring, that will really make a difference. The study that revolutionized the treatment of high pressure. One of the most important studies that changed the way we treat blood pressure was the SPRINT study, or Systolic Blood Pressure Intervention Trial. Published in 2015, this study was revolutionary in showing that reducing systolic blood pressure to lower levels could bring significant benefits, especially in the prevention of cardiovascular diseases. The study involved more than 9,300 participants aged 50 or older, all at high risk of heart disease but without diabetes or a history of stroke. These participants were divided into two groups. The first group followed a standard treatment with the goal of keeping systolic blood pressure below 140 millimeters of mercury. The second group, in turn, underwent more aggressive treatment with the aim of reaching levels below 120 millimeters of mercury. After 3 years of follow-up, the results were surprising. The intensive treatment group showed a significant reduction in serious cardiovascular events, such as heart attack and stroke. Furthermore, the mortality rate in this group was lower compared to the group that followed standard treatment. The numbers speak for themselves. About 2.19% of participants in the standard group had serious cardiovascular events over the course of a year. In the intensive treatment group, this rate dropped to 1.65%. This result proved that for many patients, reducing systolic blood pressure below 120 could save lives. However, the benefits came with important challenges. The intensive treatment group also had higher rates of adverse effects, such as drops in blood pressure, hypotension, fainting, kidney problems, and electrolyte imbalances. These side effects have raised concerns, especially when we talk about frail elderly people or those with multiple health conditions. This study made it clear that although aggressively lowering blood pressure has benefits, it should be applied with caution in the elderly. Risks and benefits need to be carefully evaluated, and treatment must be adapted to each patient's individual needs. Therefore, the results of the SPRINT study are a fundamental piece in understanding hypertension in the elderly. They show that, although the guidelines point to lower targets, not all patients benefit from such strict control. For many, keeping blood pressure around 130 or 140 may be a more balanced approach, ensuring safety and quality of life. The SPRINT study was a revolution, but also a warning. High blood pressure treatment needs to be personalized, especially in old age. What works for one patient may not be suitable for another, which is why medical monitoring is essential. When medicine becomes a risk, the dangers of intensive treatment. Controlling blood pressure is essential to prevent serious illnesses such as heart attack, stroke, and heart failure. However, aggressively lowering blood pressure, especially in the elderly, can have unexpected and dangerous consequences. The SPRINT study highlighted the benefits of intensive treatment, but also revealed that this approach is not without risks. Participants who followed more stringent goals, such as keeping their systolic blood pressure below 120, had a higher incidence of significant side effects. Among the most common problems associated with intensive treatment are, first, hypotension. When blood pressure drops too low, especially in the elderly, symptoms such as dizziness, weakness, and blurred vision may appear. These sudden drops in pressure can lead to fainting, increasing the risk of falls and fractures, which are especially dangerous for the elderly. Second, electrolyte imbalances. Many medications used to treat hypertension affect the balance of electrolytes such as sodium and potassium. These imbalances can cause complications such as cardiac arrhythmias, muscle cramps, and even changes in brain function. Third, kidney damage. Aggressive drug treatment can overload the kidneys, leading to acute injuries or worsening existing kidney problems. For elderly people, who often already have a reduction in kidney function due to age, this is an important concern. Finally, the drop in quality of life. In many cases, the combination of medications and the resulting side effects can affect the patient's overall well-being. Symptoms such as constant fatigue, nausea, and changes in mood can make the daily routine difficult and compromise the elderly's autonomy. These risks highlight the importance of personalizing treatment for each patient. Not all seniors benefit from extremely low blood pressure goals, especially if the price to pay is a series of debilitating side effects. Therefore, it is essential that doctors and patients work together to find the ideal balance. More conservative control, such as keeping systolic pressure around 140 or 150, may be safer for many elderly people, reducing risks without compromising benefits. Furthermore, regular monitoring is essential. Monitoring the effects of medications, adjusting doses when necessary, and paying attention to warning signs are fundamental steps to ensuring the safety of treatment. In the end, the goal of treatment must go beyond ideal numbers. He must prioritize the patient's general health and quality of life, ensuring that blood pressure control does not become a burden, but rather an effective form of protection. Lessons from a large study on the elderly and hypertension. Another landmark study in the field of hypertension was the CHART study, carried out in 2021. This study looked at more than 20,000 Chinese adults aged between 60 and 80 to understand the effects of different approaches to controlling blood pressure. The findings provided valuable insights into how to treat hypertension in older adults, especially in high-risk populations. The CHART study compared two main groups. The first group received intensive treatment, with the goal of reducing systolic blood pressure to less than 130 millimeters of mercury. The second group followed a standard approach, aiming for a systolic pressure below 150. The results showed that intensive treatment significantly reduced the risk of serious cardiovascular events, such as stroke and heart failure. The impact was particularly positive in reducing strokes, one of the biggest concerns among elderly people with hypertension. However, as with the SPRINT study, the benefits came with challenges. The group undergoing stricter control had a higher incidence of side effects, including hypotension, kidney damage, and electrolyte imbalances. Despite this, there was a reduction in overall mortality, suggesting that, for some patients, intensive treatment may be beneficial as long as it is well monitored. The study highlighted another important point: the individualization of treatment. While some patients tolerated the aggressive goals well, others experienced complications that compromised their quality of life. This reinforces the need to consider factors such as frailty, medical history, and the presence of other diseases when setting blood pressure goals. Furthermore, the study highlighted that age alone should not be the only criterion for determining treatment. Healthy elderly people without multiple comorbidities can benefit from more rigorous control. On the other hand, frail patients or those at high risk of side effects may need more conservative goals, such as maintaining systolic pressure between 140 and 150. These lessons are especially relevant for doctors and patients seeking the ideal balance in the treatment of hypertension. Blood pressure control is not a one-size-fits-all approach. It must be adapted to each person's needs, ensuring that the benefits outweigh the risks. The CHART study, like the SPRINT study, reinforces an essential truth. The patient's health must be at the center of any decision. Numbers are important, but it's the careful interpretation of that data that makes the difference. What makes each body unique? Customize your treatment. One of the biggest challenges in treating hypertension is that each person reacts differently. Factors such as age, genetics, medical history, and lifestyle make controlling blood pressure a task that requires personalization. In the case of the elderly, this need is even more evident. While some people over the age of 65 maintain relatively robust health, others face multiple chronic conditions such as diabetes, kidney failure, and cardiovascular problems. This diversity means that generalized blood pressure goals such as 180 are not always appropriate or safe. Patients with a history of falls, for example, may be more susceptible to dizziness caused by medications that excessively reduce blood pressure. Others, who already have kidney problems, may be at risk of worsening these conditions due to intensive treatments. In these cases, seeking less aggressive control may be the best choice to preserve quality of life. In addition to health conditions, genetic factors play an important role. Studies indicate that the response to hypertension treatment varies according to ethnic origin and individual genetic characteristics. Therefore, what works well for one patient may not be equally effective for another. Another crucial aspect is the impact of lifestyle. Regular exercise, a balanced diet, and stress control can help reduce blood pressure without relying exclusively on medication. For some seniors, these lifestyle changes may be enough to achieve safe and sustainable goals. Personalizing treatment also involves an open dialogue with the doctor. It is important for the patient to share their concerns, describe the side effects they are experiencing, and discuss realistic goals for their health. This collaborative process helps create a treatment plan that not only controls blood pressure, but also promotes overall well-being. Ultimately, the main goal of treatment should be to ensure that the patient lives healthily and comfortably. Instead of focusing only on numbers, care must take into account each person's individuality. By personalizing treatment, it is possible to achieve a balance that maximizes benefits and minimizes risks, providing a longer, healthier life. What aging does to your blood pressure. Over the years, the body goes through several changes that directly affect blood pressure. These changes are, for the most part, natural and are part of the aging process. Therefore, understanding what happens in the body is essential for effective and safe control of hypertension in the elderly. One of the main changes occurs in the blood vessels. With age, arteries lose elasticity and become more rigid. This stiffening makes blood circulation difficult, causing the heart to work harder to pump blood around the body. As a result, systolic blood pressure tends to increase, even in people who have no other risk factors. In addition, hormonal changes occur that interfere with blood pressure control. Substances such as renin and aldosterone, responsible for regulating blood pressure levels, decrease with aging. These changes make it more difficult for the body to balance ideal blood pressure values. The kidneys, which play a crucial role in regulating blood pressure, also lose efficiency over time. They begin to filter the blood more slowly and have difficulty excreting excess sodium and fluids from the body. This accumulation of fluids can contribute to increased blood pressure. These factors combined make hypertension more common among the elderly. It is estimated that more than half of people over the age of 65 have high blood pressure. However, it is important to remember that this increase is not always a sign of serious illness, but rather a natural adaptation of the body to aging. Even so, increased blood pressure needs to be monitored closely. If values exceed limits considered safe, such as 150 to 80, the risk of cardiovascular complications, such as heart attack and stroke, increases significantly. Another important point is that lifestyle can accelerate or delay these changes. Habits such as a sedentary lifestyle, a diet rich in salt and chronic stress contribute to elevated blood pressure, even in younger people. On the other hand, exercising regularly, eating a balanced diet, and keeping your weight under control can help minimize the effects of aging on blood vessels. Aging is a natural process, but that doesn't mean high blood pressure should be ignored. By understanding the impact of changes in the body, it is possible to adopt more effective strategies to control blood pressure without compromising quality of life. The secret is to closely monitor values, make lifestyle adjustments, and, when necessary, start medication treatment under medical supervision. This way, it is possible to age healthily and keep blood pressure within safe limits. Standard or intensive treatment. Find out what's best for you. When it comes to controlling blood pressure in the elderly, one of the biggest questions is, how much should we reduce the numbers? Is seeking more rigorous control, as intensive treatment recommends, really the best option for everyone? Or would it be safer to adopt a more conservative approach, focused on less aggressive goals? Traditional standard treatment aims to maintain systolic blood pressure below 140 or 150 millimeters of mercury in the elderly. This approach seeks to balance the benefits of reducing blood pressure with the risks associated with excessive medication use. For many doctors, this goal is best suited for patients with multiple comorbidities, frailty, or a history of falls. On the other hand, intensive treatment, as observed in the SPRINT study and the CHART study, seeks to reduce systolic blood pressure to values below 120 to 130 millimeters of mercury. Studies show that this approach can bring significant benefits, such as reducing the risk of heart attack, stroke, and other cardiovascular diseases. However, the risks cannot be ignored. Intensive treatment often requires higher doses of medications or combinations of different medications, which increases the likelihood of adverse effects. Among the most common problems are drops in pressure, hypotension, which can lead to fainting and dangerous falls, kidney complications such as acute or chronic failure, electrolyte imbalance, which can affect heart and muscle function, reduced quality of life due to symptoms such as fatigue, dizziness, and weakness. Therefore, the decision between standard or intensive treatment must be made based on each patient individually. There is no one-size-fits-all solution. For a healthy elderly person without major health problems, intensive treatment may be considered as long as the risks are closely monitored. On the other hand, for more frail patients with a history of falls or kidney conditions, more conservative goals may be the best option. Another fundamental point is continuous monitoring. Monitoring blood pressure regularly and evaluating the effects of treatment allows you to make adjustments as needed. Furthermore, it is important to consider the patient's quality of life. There is no point in reducing blood pressure to ideal levels if the side effects compromise the well-being and autonomy of the elderly person. Therefore, the choice between standard or intensive treatment must be based on a careful assessment. The doctor must take into account each patient's clinical history, current health conditions, and individual goals. The objective should be not just to control the numbers, but to ensure a long, healthy, and quality life. In the end, what matters is finding the perfect balance. The ideal treatment is one that brings real benefits without imposing unnecessary risks. Working together with your doctor, following every detail of the treatment, is the key to making the right choice. Smart choices for a healthier life. Throughout this text, we have seen that blood pressure, especially in old age, is a complex topic that requires special attention. Modern guidelines suggest more aggressive goals, such as keeping blood pressure below 130 or 120 millimeters of mercury. These changes, although based on important studies like the SPRINT study and the CHART study, are not always ideal for all seniors. Each person is unique. Factors such as general health, medical history, the presence of other diseases, and even lifestyle directly influence how the body reacts to hypertension and its treatment. Therefore, the decision about the ideal blood pressure target must be made individually, always together with a trusted doctor. We know that adequate blood pressure control can save lives. It significantly reduces the risk of serious illnesses such as stroke, heart attack, and heart failure. On the other hand, excessive use of medications to achieve very low goals can have adverse effects that compromise quality of life, especially in frail elderly people or those with multiple comorbidities. The secret is in balance. Monitoring blood pressure regularly, adopting healthy habits, and making adjustments to treatment when necessary are essential steps to keeping blood pressure within safe limits. After all, the main objective is not just to control the numbers, but to ensure a long, healthy, and quality life. Therefore, if you have hypertension, do not make hasty decisions. Avoid setting yourself on numbers or rigid goals without professional guidance. Talk to your doctor, share your concerns, and look for a treatment plan that is suitable for your reality. Remember, taking care of your health is a daily commitment, and small changes make all the difference. Maintain a balanced diet, practice physical exercise according to your conditions, control stress, and monitor your blood pressure regularly. With these precautions, you will be on the right path to living longer and better. Finally, never underestimate the importance of dialogue with your doctor. Your body is unique, and your needs are individual. Working in partnership with a healthcare professional is key to finding the safest and most effective treatment for you. Your health is in your hands, and the choices you make today will define your tomorrow. Value your well-being, take care of your blood pressure, and guarantee a life with more energy, safety, and tranquility.